Now that we know about the patient problems and issues, let's discuss about the intervention plans. The first aspect that we can tackle is the patient's medication management. We can suggest the patient to use a pill box to ease him to remember to take his pills as the patient is now on 3 oral medications. Next, because the patient has 2 different types of insulins, we can suggest him to place the different types of insulins in different plastic containers with large labels. We can also make a medication identification chart to allow the patient and caregiver to identify each medicine. Finally, because the patient's refrigerator is currently broken, we can request help from his neighbor or children to keep his unused insulin in their refrigerator temporarily. On the aspect of medication knowledge, we should educate the patient on the name of each medication and its functions. Next, we should re-educate the patient on the proper use of insulin, including its uses, methods, storage, and disposal methods. We should also help to identify the reason behind the patient's low perception score. And finally, because the patient is unsure of the correct frequency of Insugen R, we should help him to understand the correct frequency of that drug. In regards of the medication-related issues, the patient complained of abdominal pain while receiving clopidogrel, so we should monitor the abdominal pain to determine if the pain was caused by the drug. The patient is potentially prescribed with the wrong dose of cloxacillin, so we should call the patient's physician to reconfirm the correct dose for cloxacillin. In terms of the patient's clinical condition, the patient was found to have a high blood pressure in the recent blood check, so we should issue a referral letter for the patient to follow up with his physician. The patient also complained of dry cough while carrying heavy stuff, so we should advise him to avoid carrying heavy stuff or request assistance from others if necessary. The fifth aspect that we can focus on is the patient's over-the-counter medication. We should confirm the source and identity of cough capsule mentioned by the patient. And finally, on the aspect of financial, we can assist the patient to reach to the respective welfare department and non-governmental organization regarding his financial problem.